Welcome back to Bedside Banter Manor. In the previous episode, we focused on the importance of mobility and immunizations for our residents. Today, we will be discussing a crucial aspect of resident care, detecting and reporting changes in condition, specifically related to pneumonia. Early recognition of these changes is vital to ensuring the well-being and safety of our residents, such as Rosa Residente. Disclaimer: the goals of this series are to educate nursing home team members on pneumonia prevention and rehospitalization. This episode aims to provide essential information for identifying and managing changes in a resident's condition related to pneumonia. It is designed to enhance staff training and improve resident care at Bedside Banter Manor. It is purposefully clinically focused with the understanding that real-life scenarios or situations being depicted would be more comprehensive and holistic in nature. Key elements have been intentionally left out to encourage open discussion and dialogue, identifying situations and areas where improvements could be made in the care or services during Rosa's current stay at Bedside Banter Manor.
Good morning. How are you feeling today, Rosa?
I've been feeling a bit off, honestly. I have a cough and I'm more tired than usual. Normally, I would ask Miguel to come by to distract me a bit with some gossip about what's going on in the girls' lives, but he's away for work this week.
I'm sorry, Rosa. We will make sure to keep a close eye on how you're doing and watch your symptoms closely. Are you feeling any shortness of breath? Like it is sort of hard to catch your breath or breathe?
A bit. Should I be worried?
I wouldn't say worried, but we are going to have to stay on top of it. Finding out right away if anything is going on with your lungs is very important. We will monitor your vital signs and any other changes closely. Regular evaluation is essential to ensuring that our care interventions are effective, especially in cases of suspected pneumonia. This includes assessing respiratory function, reviewing medications, and evaluating care plans.
How often should we review these care plans?
Continuously. Evaluations should be part of our routine to identify areas for improvement and promote quality enhancement. Rosa, we're here to do a regular checkup. How have you been feeling since this morning?
Still tired and my cough hasn't gotten any better. I feel like I might have a fever.
We'll note that and keep checking you. It's important to track even small changes.
Absolutely. Rosa, I'll take your vitals now and chat with Logan. We will be back a little later to check in again. Regular monitoring helps us detect changes early and adjust care plans accordingly. This includes measuring vital signs, observing behavior, and assessing respiratory function.
What should we do if we notice any changes?
Report them immediately. Timely intervention can prevent complications.
Rosa, your temperature seems a bit higher than usual. Have you been feeling any different?
Just more tired and I can't stop coughing.
I'll let Nurse Johnson know right away.
Even minor changes can be huge indicators of health decline. Things like a persistent cough, increased fatigue, fever, shortness of breath, changes in respiratory rate, high respirations, little wet cough, low pulse ox, decreased appetite, and small changes in vitals.
Should we report these changes immediately or wait for stand-up?
Reporting it as soon as possible is critical. Delays can lead to adverse outcomes. Clear communication between all of us and our residents is crucial. Listen closely to residents and each other. Empower residents to express their concerns.
How can we encourage residents to share any changes they notice?
Create an environment of open dialogue. Make residents feel comfortable and supported in reporting changes. It's also crucial to keep families informed about any changes in their loved one's condition. Clear and timely communication with family members helps ensure they are aware and can be involved in care decisions.
Absolutely. Families are an essential part of the care team. Their involvement can make a significant difference in the residents' well-being.
We should let Miguel know about Rosa's change of condition, right? I have a good relationship with him. Do you want me to give him a call on this one?
I really should give him a call. Thanks though, Logan.
Rosa's condition was closely monitored last night. Her temperature has stabilized, but we'll continue to observe her cough and fatigue.
You've done great so far, Logan. We want to look out for symptoms such as a persistent cough, increased respiratory rate, shortness of breath, fever, chills, chest pain, confusion, and fatigue. These can be indicators of pneumonia. We will be talking about this a bit more in our training later today. Good afternoon, everyone. Today, we will be discussing the importance of recognizing and responding to changes in our residents' conditions, focusing on pneumonia. Educated staff and residents are better equipped to identify significant changes and respond appropriately.
How can we ensure that we are fully trained to notice these changes?
We provide comprehensive training on observation skills, reporting procedures, and effective communication. It is also crucial to educate residents and their families about the importance of reporting any changes they notice in their health. It is also extremely important to know how to effectively use the documentation and prompt updates in the electronic health record, or the EHR, as it is crucial for resident safety and quality care.
How do we ensure we're using the EHR correctly?
Always enter data immediately after an assessment. Include details about any symptoms and vital signs, as well as the residents' comments. This ensures everyone on the care team is up to date. Let's pull up Rosa's EHR and take a look.
Rosa's recent entries show a stable temperature but persistent fatigue and cough. Should we update her care plan?
Yes. Let's document these observations and adjust her care plan to increase monitoring frequency. We'll also notify the physician through the EHR and follow up with a phone call. Let's ask the doctor for oxygen and nebulizer orders, along with a chest X-ray. Timeliness is key in these situations.
It looks like Rosa was due for another check-in about an hour ago. Nurse Johnson, I noticed Rosa's respiration rate is high, and pulse ox is low. I'm going to document this as a stop and watch alert in the system.
Logan, are you sure the pulse ox is working properly? Were her fingers cold or did she have nail polish on?
Her fingers were warm, and she didn't have any nail polish on. Should I try a different finger?
Yes, and remember that darker skin tones can sometimes give inaccurate readings. Let's assess her thoroughly. Rosa, were you a smoker? And when were your last labs done? This could be related to your COPD.
I used to smoke and I don't remember my last labs.
Let's call the doctor for standby orders and get a PRN order for oxygen and a nebulizer treatment. Have you had anything to eat or drink today?
I don't remember and I haven't been going to the dining room.
We are going to put you on something we call transmission-based precautions right away. It just means we will be wearing more stuff when we come in to visit you. There is nothing different you need to do. You've got something happening in your lungs and we are going to keep a close eye on you.
Detecting and promptly reporting changes in a resident's condition, especially in cases of pneumonia, is a collective responsibility that enhances the safety and well-being of our residents. By staying vigilant, communicating effectively, and working together, we can ensure that residents like Rosa receive the best possible care. Thank you for joining us in this episode. Together, we can make a difference in the lives of our residents. See you next time at Bedside Banter Manor. Now, we would like to hear from you. What could Bedside Banter Manor have done better? What other opportunities for improvement did you see? Thank you so much for joining us here at Bedside Banter Manor. We hope to see you again soon.